When performing a nerve block, injecting around the mental nerve will anesthetize the lower lip and chin area. In addition, an infiltration anesthesia near the mandibular foramen will anesthetize part of the oral mucosa and surrounding tissue. For this, a local anesthetic containing about 2% lidocaine with epinephrine is used. Facial anesthesia can be performed in this way. If anesthesia needs to be extended to the neck, an injection at this point will block branches of the cervical plexus, particularly the supraclavicular nerve, resulting in loss of sensation in the neck and clavicular area. At this location lies the sternocleidomastoid muscle, so injecting here provides effective anesthesia for procedures. For disinfection, we use alcohol for the neck and hairline areas, while for the face we use Zephanon, which is non-irritating. Hello, my name is Dr. Lim Jong-Hak from KAIROS Plastic Surgery Clinic. I hold medical licenses in Korea, Japan, and China. I practice as a plastic surgeon not only in Korea but also in Japan. Today's patient is a woman in her early 30s from Colombia. She has a relatively full face due to excess fat. For the double chin, we'll first perform fat dissolution and then suction. For the jawline, we're planning a tightening treatment to refine the contour. The basic local anesthesia has already been completed. Next, we'll proceed with tumescent anesthesia. For each area, we usually inject about 10 to 20 cubic centimeters. The standard solution is prepared with 1 liter of normal saline, 10 cubic centimeters of 2% lidocaine, and 1 ampule of epinephrine. Sometimes we also add a small amount of sodium bicarbonate to reduce injection pain. We will inject the tumescent solution through a small opening. This opening can be made either with a scalpel or with an 18-gauge needle. Among the various injection techniques, I prefer the simplest and easiest method. This area has already been nerve blocked, so the patient won't feel severe pain, though some discomfort may still occur. The solution is injected into the deep fat layer first. Typically, we inject about 10 to 20 cubic centimeters per area, but in fact, injecting a sufficient volume helps reduce pain. After that, we also infiltrate the superficial layer. From here, I will inject toward the hairline direction. Since it's along the hairline, the entry point is not visible. In this area, because there are facial nerves and vessels, it is actually better to inject a slightly larger amount. For the cheek, I usually inject about 20 cubic centimeters into the deep layer. For the double chin area, another 20 cubic centimeters is recommended, again into the deep fat. This line here is the cervical angle, which is the border between the neck and the jawline. When this area is properly treated, the neck looks longer and the overall contour becomes more attractive. We will inject on the opposite side as well. From this side, we can achieve a pulling effect, and tightening will also be performed. Since the anterior facial vessels and nerves pass through this area, sufficient anesthesia is required. First, the deep layer is injected, followed by the superficial layer. We usually inject about 10 to 20 cubic centimeters, spreading it evenly. This area is specifically the deep submandibular fat layer. Injecting here allows the solution to spread into the fat, and the epinephrine causes vasoconstriction, which helps prevent bleeding. This patient is young, with a small and slender face, but she has a rather prominent double chin. Finally, we inject about 10 cubic centimeters into the double chin area from 2 directions to ensure anesthesia is well distributed. After that, we wait about 10 minutes for the anesthesia to take full effect before starting the procedure. On the right side, enough time has already passed since the anesthesia, so the epinephrine has caused vasoconstriction. This allows us to aspirate fat without bleeding. Today's focus is mainly on treating the double chin. The cannula is the insulated so that energy is released only at the tip. This minimizes the risk of burns and allows us to precisely target the fat layer. As for the indicators, green means standby, blue indicates energy output, and red signals an error. For the double chin and jawline, we usually work at 40 to 50 watts. However, for those who are not yet familiar with the device, it is better to start at a lower setting, around 30 to 40 watts. The settings can also be adjusted during the procedure as needed. Insert the cannula deeply into the anesthetized area, reaching the deep fat layer. Then move it slowly back and forth to create a tunnel. Each area typically takes about 3 minutes. If the heat builds up too much, the indicator will turn red and the device will automatically stop. During treatment, keep moving the cannula gently back and forth. If the indicator turns red, it means energy output has stopped. At that point, simply press the foot switch again or the on button on the handpiece to restart the energy flow. Fat dissolution is progressing very well. About 3 minutes per area is usually sufficient, and since the device automatically adjusts itself, the procedure is very safe. Now we will proceed with liposuction. An 18-gauge needle can penetrate up to about 2 millimeters. If the suction cannula does not pass easily, a small puncture can be made with a scalpel. Since the fat has already been emulsified, suction is very easy, and by removing only the liquefied fat, post-operative swelling is minimized and recovery is faster. Afterward, we gently express any remaining fat by pressing. We will now treat the opposite side as well. If a scalpel incision was used, a small suture may be needed afterward. Next, we perform subcision or tunneling through the fat layer. Because the fat layer offers little resistance, this step is quite straightforward. For such procedures, general or sedation anesthesia is not necessary. Local anesthesia alone is safe and painless. This allows the surgeon to fully concentrate on the treatment. The device is very user-friendly, shortens procedure time, and provides excellent results. This device not only dissolves fat, but also delivers an impressive tightening effect. If the temperature rises too high, the energy automatically shuts off for safety. The target temperature is set at 50 degrees Celsius, and regulation begins 5 degrees Celsius before the target, ensuring that the temperature never exceeds the safe limit. This makes the treatment extremely safe, with no risk of burns. Achieving visible improvement in just 3 minutes per area is a remarkable advantage. It is especially important to treat the double chin and the cervical line precisely. In the more superficial layer, moving the cannula gently under the dermis while delivering RF energy promotes collagen regeneration. When the cannula tip is visible just beneath the skin and moved in a scraping motion, tightening and lifting effects are achieved. This works on the same principle as thermage, but with a key difference. Thermage delivers RF energy from the outside, whereas APOLEX Tite delivers RF energy directly into the fat layer. This results in immediate effects with outcomes that are both superior and longer lasting. Now we will suction the dissolved fat. Using manual negative pressure, the fat is removed easily since it has already been broken down, so there is almost no resistance. Just move the cannula gently back and forth while aspirating. In Western patients, the subcutaneous fat layer is usually thicker and tougher compared to Asian patients, and they often have more fat. In those cases, it is better to place the cannula slightly deeper. Next, we will treat the central area of the double chin, which is the most important part of today's procedure. Always remember to insert the cannula first before activating the energy. Move the cannula slowly back and forth, changing directions during the treatment. This prevents irregularities or hollowness after the procedure and ensures that the fat is removed evenly. Now we begin suction. In fact, this method is not really traditional suction. It is more like manually removing the liquefied fat. This way, swelling subsides faster and recovery is much quicker. Finally, by gently squeezing out the remaining fat, the overall jawline contour will appear much smoother and more defined. In this area, we will focus on tightening rather than fat dissolution. For this, I will use a short and thin 0.8 millimeter cannula. While changing the cannula type, I will squeeze under the chin with gauze. The cannula will be inserted from this point for the procedure. Here the goal is mainly tightening, although some fat will also be dissolved. We begin with a little pre-tunneling or pedaling motion and then proceed with the treatment at a slightly lower power setting. In this area, the facial nerve is present, so generally I do not recommend treating here. However, since the nerve lies in a deeper layer, performing the procedure at a superficial level is not a major concern. This is the jowl area, sometimes called the pouch, and it is one of the areas where treatment results are most noticeable. Here I will set the device at 30 watts. By treating with a scraping motion along the skin, we can achieve both lifting and tightening effects at the same time. Suction is not really necessary in this area, but since some fat has already melted, I will remove it. Even though the focus here was tightening rather than fat dissolution, more fat than expected has come out. Finally, we will perform squeezing to refine the contour. First, we create tunnels, and it is very important to mark any depressed areas of the face beforehand to avoid treating them. Otherwise, scarring may occur after the procedure. In this area, there is a small amount of fat, so we will proceed with fat dissolution. Now that the fat has been dissolved, we will move on to tightening. The cannula should be moved gently back and forth, almost like scraping along the dermis. We will also do some light suction here. Remember to keep the opening of the suction cannula facing downward. Otherwise, scarring may occur. To finish, we will perform squeezing and, if necessary, place just 1 or 2 sutures. For facial suturing, we use 6-0 or 7-0 nylon, and the stitches are usually removed between day 4 and day 7. Suturing helps the wound heal in a much cleaner way. After the procedure, any remaining fat will gradually be eliminated from the body through the lymphatic system or urine over time. The procedure is now complete. Here is the amount of fat that has been removed today. You may feel some numbness in your face due to the anesthesia, but this will resolve within about 2 hours. You can return to your normal daily activities starting tomorrow. Some swelling may persist for about 3 days, but it usually subsides within a week. The contouring effect will gradually develop over 1 to 3 months. Please wear the compression band continuously for the first week and then at night only for the following month, as this will enhance the results. As precautions, keep your head elevated above chest level as much as possible, even when lying down. Antibiotics should also be taken as prescribed. Wearing the band for 2 to 3 consecutive days will also help the treated area settle into a more defined and attractive shape.